May I know the reason why you want antibiotics?
Yes, doctor, because recently my nephew has got meningitis, and I believe that I need antibiotics so that I won't get it.
Hmm. Is it okay if I ask a few questions to have better understanding so that I can address your concerns?
Okay, doctor.
Mm. So, how is your nephew right now?
Yes, he's a bit better.
Mm.
His fever has subsided and he's on treatment. Luckily, we got the treatment timely, and he's doing fine. But I'm really concerned about myself right now because I my sister told me that she was also given antibiotics to prevent her from getting meningitis, and that is why I'm very much peculiar that I should also get that too.
Oh, okay, do not worry, Annie. I'll help you with this. Um, so when was he diagnosed with meningitis, your nephew?
It was last week.
Okay. And when was the last time you visited him?
Well, I visited almost 2 months back.
Mm, okay. And do you have any silent symptoms?
Like
Like,
what,
do you have
doctor?
any fever? Do you have any fever?
No, doctor, I don't have any fever.
Any headache?
No,
Any a sign away from light?
no, doctor.
Okay. A vision problem?
No, I'm otherwise absolutely fine. I just want to
Mm-hmm.
not to get it in future. That's why I was a bit. Uh,
Mm-hmm.
I was expecting you to write me some antibiotics because my sister also got it.
Mm-hmm. And when have you visited your sister recently?
No, doctor. I told you I visited her and the nephew 2 months back.
Okay. And do you have any medical conditions?
No,
Are you allergic to anything?
no, doctor.
Do you take any regular prescribed medications?
No.
Have you been vaccinated against meningitis?
I don't know, doctor, about that.
Okay. Um, um, a few questions regarding your lifestyle. Do you smoke?
No,
Do you drink alcohol?
no.
Uh, what do you do for your living?
I'm a teacher at a nursery.
Mhm. And is there anyone in your workplace who has fever?
No, actually, no one has fever or anything at my
Mm.
workplace, but I'm really concerned that I should get the antibiotics so that I may not get meningitis. And that is how I believe I won't be transferring it to my students.
Okay, okay, I'm getting your points. Okay, Annie, uh, I would like to examine you. Will that be okay?
Yes, sure.
Okay, I'll like to take your observations, measure your temperature, um, your blood pressure, your heart rate, breathing, and oxygen level in your blood. I'll also like to do your general physical examinations, and I'll also like to do your neurological examinations. Will that be okay?
Yes, doctor. Everything is normal.
Okay, so Annie, from the history, you mentioned that you have visited your nephew and your sister 2 months back, and um, you do not have any silent symptoms like fever, headache. So I don't think that at this time you have got any meningitis.
Okay.
So there is no points in giving you antibiotics right now.
Okay, doctor, but my sister also didn't have any any meningitis, but she still got
Mhm,
some antibiotics. I don't know. She was telling me
mhm,
that the doctors were saying it's for prophylaxis, maybe to keep her safe
mhm,
from being caught up by the
mhm,
meningitis.
mhm. Right, you're right. We give antibiotics, prophylactic antibiotics, but the prophylactic antibiotics are given to the people who are in contact with the patients. And your sister um, is um, is in contact with your nephew. Maybe that is the reason they have given her antibiotics.
Oh, okay, I see now. I understand
Mhm.
your point now. 2 minutes remaining.
So, if we only give the antibiotics when there is a contact with the people who have meningitis, and if they are in close contact, like they are sharing the same house or sharing the same room, or if we have a contact with the people with meningitis for more than 24 hours, then in that situations we give the prophylactic antibiotics. Am I clear to you?
Yes, doctor. Now I'm getting your point.
Yes.
Yes, it's clear.
And however, yes, as you mentioned that you have not seen them for last 2 years, 2 months, and you don't have any sign and symptoms, so there is no point in giving antibiotics to you.
Oh, okay. So you were talking something about vaccinations. Do I need to get myself vaccinated?
Yeah, well, Anna, that there is all these vaccinations are usually given to prevent the infection in the futures. So we can, if you want, then we can give you vaccines so that you won't get any meningitis in the future. And for that, I can refer you to the public health team. Will that be okay?
Okay. Yes,
Okay, as
sure. They will be
you,
giving me vaccinations.
uh, uh, they will assess you, and if you are not immunized against the meningitis, then they can offer you vaccination.
Okay. All right, doctor. I got your point.
Okay, as do you have any concerns?
No, I was just concerned about getting meningitis, and it's good that you are referring me to the public health team so that I can get vaccinated.
Okay. And moreover, if you have some medical conditions, like you are immunocompromised, you are taking some steroids, in that case, we actively suggest you to go for the vaccinations. However, if you want to get it vaccinated, then they can check you, examine you, and they can offer you. Okay.
Okay, your time is up, doctor.
Okay, thank you.
Thank you, doctor. I must say it was a brilliant performance, Dr. Pratima. Very, very well done. You did it really well. The time management and covering all the points and addressing all the concerns, it was really a good attempt. So just let me do the other scenario with the other candidate, and then I will give you a proper feedback about this station, okay?
Okay.
All right. So our next candidate for today's session was Dr. Mohsin. Are you there, Dr. Mohsin? I believe Dr. Mohsin is not here. So anyone else from the people who are here, you can raise your hand if anyone of you want to perform the next station. Anyone who is willing to perform the next station? Okay, Dr. Obed.
Yeah.
Okay. Can you tell
Yeah.
me when
Hello.
your exam? Hello.
Hello.
Welcome to the session, Dr. Obed. Can you hear me?
Yes, I can hear you. Can you hear me too?
Yes, you're audible. So can you tell me when is your exam?
September 19th.
Okay. So are you ready to perform today?
Yes, I am.
Okay, that's really good to know. Okay, let me just share your
797998. Hello.
hello.
Yeah. Good evening.
Hello.
Hello. Good evening.
Good evening, doctor.
Yeah. So this is Dr. Ben Mensah. I'm speaking from the GB practice. Can I know who I'm speaking to?
Yes, doctor, I'm Ella Jones, and I want to talk to you about my daughter Sarah. So was she to the practice?
All right, Sarah. Can I confirm something small before we continue?
Okay, doctor.
Can you confirm your age for me?
Yes, doctor, I am 34 years old.
Okay, that's good. And where are you speaking from? What's your address?
I live at Salford Street, Manchester.
Okay, all right, thank you. How can I help you?
Yes, doctor, I'm calling because I want to talk to you about my daughter Sarah. I want to know that has she been to the practice recently?
Your daughter Sarah. Can you give me the full name?
Yes, she's Sarah Jones. She's 15
Sarah
years
Jones.
old.
Okay. Okay. All right. All right. Yes. Sarah has been to the practice recently.
So can you tell me that did you prescribe her any oral contraceptive pills?
Um, Sarah. Can I find out something small from you?
Okay, I'm actually Ella, her mother, Sarah's mother.
Okay. All right. All right. Oh, Ella. Sorry about that. Ella. So can you tell me why are you inquiring about this?
Doctor, I'm really worried because I was cleaning my daughter's room today and I found some oral contraceptive pills under her bed. And this is something I wasn't expecting at all. So I want to know if you prescribed her with these OCPs. She's just 15 years
Oh.
old. I want to know what she's doing.
Oh, okay, Ella. I can understand why you are concerned because I mean any parent can or would also be concerned about this. But can you tell me more about Sarah?
Like what, doctor?
Has he been diagnosed with any condition?
No, she's absolutely fine otherwise, but I'm very much concerned that why is she taking OCPs and where did she get that from? Because he's only 15 years old and you know it's illegal to have sexual activity at this age. I'm really concerned that why was she given OCPs and who gave it to her?
Yes, Allah, I do understand that you are concerned with your daughter, okay? But we need to let you know that though Sarah visited the practice, I cannot, unfortunately, let you know what discussion and what prescriptions went on between us, unfortunately.
So that means if she came to the practice recently, you were the one who prescribed her OCPs. It is all clear.
No, Ella, that isn't it. The idea is that Sarah might have come to the department with certain concerns which we had to address. Okay, and for that matter, we managed to manage whatever concerns that she had. Okay, and then she was managed adequately. I cannot say for sure that we gave her that. Whatever thing that was done was between us and Sarah, and I am so sorry. I'm not in the state to let you know if we prescribed that for her. Sorry.
Doctor, she is just 15 years old. I am the mother. I have all rights to know what's going on with my daughter. And you do understand that it's illegal to have sexual activity at this age. I can even sue you guys for encouraging her to do this. So I want to know that did she get it from there, so that I can properly inquire her, because she is not responding to me. She's not answering me, and she's not telling me where did she get this from.
Yes, Sarah, I perfectly do understand that, yes, it is illegal for her to have that sexual intercourse, but whatever thing that has gone on between our practice and Ella, it's confidential, and it's though you are the mother, we are not in the state to disclose that to you, because we found out that Sarah had the capacity to make that decision. Okay, so I am very, very sorry, and it's quite unfortunate, but it's something that I cannot do.
So, doctor, how am I gonna find out what's she doing with the OCPs, and how do I find out that she's safe or not, and who is she in relation with? She's not even talking to me about this.
Okay, so Ella, I think
2 minutes
the
remaining.
best thing. Hello?
2 minutes remaining.
Okay. Okay, Ella, so I think what we can do is for now, if you really want to know, you have to take time, okay, and talk very wholeheartedly with Ella. I'm sure she would be able to open up to you, and we should let you know if she's in any relationship of any sort. Are you getting me?
Yes, I do get you, but I tried asking her and she slammed the door on me, and she said that it belongs to her friend. But why would her friend's OCPs, what would they be doing in her room? It's understandable that she's lying to me, and she just, when I confronted her, she just slammed the door and left house. And I'm just so mad at all of this. I just want to know, where did she get that from, and what is she into?
Sarah, I'm very sorry for Ella's behavior and for the fact that she smacked the door on you. But I think in this case, the only thing that we can do is to try to talk to her. Maybe you could involve some family members, okay, or some people in the community with whom Ella has some trust for, okay, and she could possibly open up to what is going on. Is that okay?
Okay, I guess I'm not getting any help from here. Doctor, can you understand what I'm going through? If it was your daughter, what would you do? Wouldn't you be worried about her, that what she is up to at this age? I don't understand, why are you not cooperating with me? I'm just so worried about her.
Yeah, Sarah, I perfectly do understand. Okay, and if I was a parent, I would also be very worried. But our statutes, I mean, show that we should also have that confidentiality. Okay, so I cannot draw out information that we have confidently had, and discussion that we have had with Ella. So please do bear with us, and if possible,
move on to the next
and
station.
I mean, it's going to be possible as well. Try and talk to Ella. Okay, get in other people who can help you, so that she can open up to you on what is actually going on with her life. Okay, is that okay?
Okay, doctor. All right, your time is up.
All right, thank you. Huh.
Thank you, doctor. You did a really good job, and I believe you have been practicing for some time now. That is why you know these scenarios, and you are doing a good job, because you have quite far away. Your exam is quite far away.